So, who's doing what? Little bit around the world. France, actually doing an awful lot. One of the most centralized systems, doesn't work quite as well as perhaps it could do, but some of the things they're doing are fantastic. Their use of postal workers to help older people, where they found a new use for all those postal workers in different countries that have got fired. The French just use them to assist older people in their own home, to ensure they have social interactions. Hey, why not? Isn't it common sense? I mean, really good idea. Denmark, they're doing an incredible amount. A new hospital in Odense, which is in the south of Denmark. This new hospital won't have hospital departments. I know the person who's leading it. He abolished the Department of Surgery, the Department of Medicine, the Department of Orthopedics. He has functional teams actually managing healthcare for a population, a new type of hospital. Introducing all sorts of technology like jerry cases for older people, and also actually managing as a country to reduce 20% of their acute beds in about 3 or 4 years. Big stuff, but they did it. Netherlands, GDPR, which is the mechanism for ensuring that the citizen has control over their digital records, making it work the way it should rather than the way it shouldn't. Having government really get stuck into that. Wonderful stuff. In Spain, some of the best healthcare systems you could hope to find. In Catalonia, they have, in Badalona, health and social care under the same umbrella. In Valencia, as I said, they transferred the risk. Finland, which is wonderful, you have everything from Mycanta, which is a digital vehicle where every patient can access their medical record, interoperability, secondary use of data, all wonderful stuff. In the Gulf states, there's been an incredible speed at which some of these countries like Dubai, Saudi Arabia, are moving to have interoperability imposed, working really fast, doing things the right way at breakneck speed, because possibly they don't have so much to take away as some other people. Singapore, always the place we talk about, but you know, again, it's small, and because it's small and it's unified, it's less easy to move that into a big country like Canada or the United States or Europe. Even places like Japan, where they have probably the best social care system in the world, but not necessarily the best health system. And Australia, where they've tried manfully to manage digital uptake for populations. So things are happening, but in Canada, you're in a good place. You are the place where a lot of the thoughts start. If I have to start somewhere in terms of thinking around some project, the first thing I look at is what's happening in Canada, because this is the best laboratory in the world. You have a skilled workforce, you know where you want to go to. Yes, it is extraordinary that it's a country where there are all the bits to create the most wonderful vehicle, but somehow the vehicle never gets built because you never actually take off. But besides that, I think it's one of the best places you could be in. And I would be more positive about your chances at actually getting a really good health system for your population, because I've been to a lot worse places in the world, I can tell you that, and I've been to a lot of places.